Hey guys, Dr. Berg here. In this video, I want to talk about low-calorie diets versus intermittent fasting. The confusion that people have is they think that it's the same exact thing. No, it's completely the opposite thing. So low-calorie diets actually slow your metabolism. Actually, it ruins your metabolism. It takes the set point and it raises it. So before you could get your weight down to this weight, now it keeps rising and it'll just like your body gets comfortable at a certain weight, like say 185 pounds, and you can't seem to get below that. Intermittent fasting, if done correctly, speeds up your metabolism. It lowers the set point. It allows your weight to go down. It's the only thing that I know that as a tool that you can fix and heal your metabolism, okay? So low-calorie diets create a breakdown of muscle tissue. It makes you weaker over time. Intermittent fasting causes improvement in muscle and it retains protein in muscle tissue. And that's because of the hormone called growth hormone that's triggered when you do intermittent fasting. Okay? Low-calorie diets cause cravings to carbs and sweets. It also keeps you hungry because it's depriving you. Intermittent fasting, you have no cravings. You have no hunger. So the way that you know that you're in you're actually doing this correctly is when your cravings go away. If you're going to do a program and you're craving, you're not doing it correctly and you're not really in fat burning when you're doing this. Low-calorie diets do not put a person in fat burning. Intermittent fasting does put a person in fat burning because it influences hormones. Low-calorie diets ignores the hormone aspects of what calories influence. So they don't look at how food triggers hormones, insulin, cortisol, estrogen. They're basically saying all calories are the same, just eat in moderation, just reduce your overall calorie. Bad advice. Intermittent fasting, done correctly, looks at the hormone aspects, like specifically insulin. Because when you do intermittent fasting, you're eating and then you're not eating, and then you're eating and you're not eating. So when you don't eat, you don't trigger insulin. When you do low-calorie diets, a lot of times you're grazing and you're snacking, but you're having just little amounts of that thing. Low-calorie diets typically ignore the nutrients in the calorie. They kind of look at, again, a calorie is a calorie, but there are certain calories that are more nutrient dense than others, right? So that's the difference. So this is basically reduction of calorie. This is a reduction of frequency of eating. This is not lowering your calories when you eat. So when you do intermittent fasting correctly, you want a meal, of course, that doesn't have sugar. You want a meal that has healthy fat. You want a meal that has a moderate amount of protein. And you want a meal that is nutrient dense, a lot of vegetables. But you're never going to be cutting calories. You're going to have a nice big meal. And then that's supposed to get you to switch over to fat burning when you're not eating, going for a long period of time. But we're only talking like if you did 3 meals a day or even twice a day and then not eating between that. That's a form of intermittent fasting. But I just want to clarify the difference so you really get this. This is really bad. This is really good. All right, thanks for watching. Put your comments below. Hey guys, thank you so much for watching. Please click the subscribe button and I will see you in the next video.